In this lesson, we're going to talk about pancreatitis. Before we do that, let's review the functions of the pancreas. It's like we always say, once you understand how something works, it's much easier to understand what happens when it doesn't work right. All right. So the pancreas is both an endocrine gland and an exocrine gland. Endocrine gland means it secretes hormones directly into the bloodstream. Now, those are insulin, which decreases blood glucose, and glucagon, which increases blood glucose. So exocrine means it secretes these chemicals into the GI tract. The pancreas secretes these digestive enzymes like amylase, lipase, trypsin, and nuclease. Amylase breaks down carbs. Lipase breaks down fats. Trypsin breaks down proteins. And nuclease breaks down nucleic acid. So the pancreas plays a huge role in digestion and absorption of food and nutrients. So pancreatitis is inflammation of the pancreas. That's the itis part. And what's interesting here is that the pancreas will actually start to eat itself or autodigest itself, autodigestion. Now, ultimately, what happens with this is the pancreas begins to lose function. The two most common causes are chronic alcoholism and gallbladder disease, especially if these ducts become obstructed. You can see here that the exocrine duct of the pancreas joins with the common bile duct right before it enters the duodenum. So if there are gallstones blocking this up, or if there's inflammation here in the bile ducts, it can obstruct the pancreatic duct as well. Then we also have things like hyperlipidemia, peptic ulcer disease, and of course, pancreatic cancer, which can all cause inflammation of the pancreas or pancreatitis. The number one symptom of pancreatitis is severe abdominal pain. This is an extremely painful disease. Now, the pain is usually mid-epigastric of the left upper quadrant. All right. They're also going to experience nausea and vomiting and a lot of weight loss because of malabsorption. All right. Think about how they aren't digesting and absorbing the nutrients like they should. They're also going to have an elevated white blood cell count, bilirubin, ALP, elevated amylase, and lipase because they aren't being used. This amylase and lipase aren't being used at all. You're also going to see colon sign, which is this bruising around the umbilicus, like you can see here. All right, and Gray-Turner sign, which is bruising on the flank. And finally, you're going to see steatorrhea, which is fatty, foul-smelling stools. Now, if you've ever smelt this before, you're never going to forget it. So the number one goal, the number one medical management goal, is to suppress or decrease the amount of enzymes that the pancreas secretes. Now, we're going to do this to try to limit that autodigestion. If the pancreas isn't secreting all these hormones, it's not going to start eating itself up. So we're going to make the patient NPO. Now, it's important that we make sure they're getting hydration while they're NPO. So we're going to start IV hydration and TPN, which is really just nutrition through an IV. All right. Now, as far as medications, we're going to give analgesics. These patients, again, are in just a tremendous amount of pain. If there's one thing you remember the pain, okay? And then with pancreatitis, we're actually going to give anticholinergics. Now, the reason we do this is that these meds are actually going to decrease gastric secretion and gastric mobility. And they're going to decrease motility. All right. Now, the less gastric activity we have, the less pancreatic stimulation that we're going to have. Now, and that's actually what we want. And then, of course, keep in mind that the pancreas controls insulin and glucagon. So we need to monitor blood sugars. We want to monitor them very closely and give those meds to them as needed. All right. Now, as far as procedures go and things that we can do, one of the most common things you'll see is ERCP, or endoscopic retrograde cholangiopancreatography, or ERCP. That's how you're going to hear it said. Now, anytime you see chole or cholangio, think gallbladder. Basically, what we do is we insert a scope down into the duodenum. You see the scope going down here. And then a probe looks backward up into the common bile duct. That's the retrograde part. They do this to look for any gallbladder issues and to remove gallstones or any other duct obstructions that might be there. We may also see the patient get their gallbladder removed, and that's referred to as a cholecystectomy. Now, we could see them remove the pancreas altogether. Okay. Now, if they remove the pancreas altogether, keep in mind these patients will instantly become diabetic, and they're going to need insulin and glucagon for the rest of their lives, as well as having to take supplemental pancreatic enzymes, the amylase, the lipase, all those pancreatic enzymes they're going to have to be taking. Finally, there's also a procedure called a Whipple procedure, which could be done for pancreatic cancer or some other kind of lesion on the pancreas itself. Now, what they're going to do is they will remove the first part of the pancreas and the duodenum, then reattach the stomach and the tail of the pancreas to lower down on the small intestine to the jejunum. If there was some sort of injury or lesion causing pancreatitis, a lot of time this will fix the problem. Now, the priority nursing concepts that I want you to keep in mind with pancreatitis are comfort. Your patient is going to be in a tremendous amount of pain. Then nutrition, because they lose their ability to digest and absorb nutrients, and they may need to be on TPN. And patient education, because of all these lifestyle changes that they're going to be going under, especially if they have their pancreas removed. Now, it's incredibly important that we educate these patients to stop drinking alcohol. Now, it's extremely hard on the GI system, including the pancreas, so make sure you check out the care plan attached to this lesson for detailed nursing interventions and rationales with pancreatitis. Now, let's recap a little bit. Pancreatitis is inflammation of the pancreas that leads to autodigestion and loss of function of the pancreas. It could be acute or chronic, and the acute is going to resolve fairly quickly and on its own, and the chronic is going to lead to progressive loss of function of the pancreas. Common causes of pancreatitis are chronic alcoholism and gallbladder disease. Patients are going to present with an enormous amount of pain, severe abdominal pain, nausea, vomiting, weight loss, plus they might have this bruising around the umbilicus or on the flank. Now, it's possible to remove the pancreas to alleviate the pain or alleviate this problem, but it will leave the patient on medications and supplements for the rest of their life. So our priority, in addition to managing their pain, is going to be making sure that we manage their nutritional needs, because they're likely going to be in PO, they might be on TPN for a while, and they're going to be changing up their entire diet and therapy as they move forward. All right, guys, that's pancreatitis. Make sure you check out the rest of the resources attached to this lesson to really get this information and understand it well. So now go out and be your best selves today. And as always, happy nursing.